High blood pressure, it's often called the silent killer for a reason. But guess what? The script is flipping. Thanks to the new 2025 guidelines from the American Heart Association and the American College of Cardiology, we have the clearest playbook ever to take back control. So let's dive right in and see what these new rules really mean for you and me. And if you think this is some kind of niche issue, think again. Look at this number, 46.7%. That's the percentage of adults in the US walking around with high blood pressure. We're talking about nearly half the population. So yeah, this explainer, it's pretty much for all of us. Okay, so here's our game plan. We're going to walk through this together, step by step. First, we'll get the lay of the land. What is high blood pressure, really? Then we'll talk about how to measure it the right way, because trust me, accuracy is everything. After that, we'll get into your lifestyle action plan, figure out when medicine might come into play, and finally, check out some of the super exciting new stuff on the horizon.
All right, let's start at square one, the absolute foundation. What exactly is high blood pressure according to these brand new 2025 guidelines? The categories are way more defined now, and it's absolutely crucial to know exactly where you fall.
So check this out. We've got 4 official lanes. Normal is exactly where you want to be, less than 120/80. Elevated, that's a yellow flag, a warning sign. But here's the part you really need to see. Look at the word "or" for stage 1 and stage 2. This is so important. It means only one of those numbers, either the top one or the bottom one, has to be in that high range for you to be classified as having hypertension.
And this chart really drives home why this is a conversation we all need to have, especially as we get older. You can see that for younger adults, it's about a quarter of folks. But then, bam, it jumps to over half for people in their middle age. And then look at this, a staggering 75%, 3/4 of people over 60. Age is a huge, huge factor.
Okay, so we know the categories, but that leads to a huge question. Are we even measuring it right? Because think about it, if the measurement is off, your whole diagnosis, your whole treatment plan could be completely wrong.
You know, the new guidelines are incredibly specific on this, and for good reason. It's not just about throwing a cuff on your arm. You need to be resting, no caffeine, positioned just right. But here's the real key, the thing you absolutely have to remember. A diagnosis of high blood pressure should never, ever come from just one reading. It has to be an average of at least 2 readings on 2 different days.
But what happens at the doctor's office is just a snapshot, right? That's where home monitoring comes in, and it's a total game changer. It helps you avoid what's called white coat hypertension. That's when your pressure spikes just because you're nervous at the clinic. And even more importantly, it can catch masked hypertension, which is kind of the opposite and sneakier. Your pressure looks fine at the doctor's, but it's actually high the rest of the time.
Now, I know what you're probably thinking. Hey, what about my fancy new smartwatch? Well, the guidelines have something to say about that, and they really don't mince words. They're issuing a direct warning. For now, things like smartwatches are just not reliable enough to diagnose or manage high blood pressure. Stick to a validated device with a cuff.
Okay, so once you have an accurate reading, it's time to talk about the first line of attack. And honestly, this part is incredibly empowering. Let's look at the lifestyle action plan, because these non-drug interventions, they are seriously powerful. And they all add up, which is the best part. First up, weight loss. Just losing at least 5% of your body weight can drop that top number by an average of 7 points. That's huge. Next, adopting a heart-healthy diet, something like the DASH plan, well, that can knock off another 6 points on average.
How about salt? Slashing your sodium intake, we're talking reading labels and watching processed foods, delivers another powerful 7-point drop. And finally, exercise. Getting regular physical activity, especially something called isometric training, think wall sits or holding a plank, can lower it by another impressive 6 points. I mean, you start adding all of that up, that's a drop as big as some medications, all without a single prescription. But let's be real. What happens when lifestyle changes just aren't enough to get you to your goal? Well, that brings us to the second part of our action plan, understanding when medication becomes necessary.
And the honest answer to that question is no. For a lot of people, especially if their numbers are higher or they have other health risks, lifestyle changes are the critical foundation, but medication is that essential next step to really protect their heart, their brain, and their kidneys. So when it is time for medicine, doctors have a toolkit with 4 main types of proven first-line drugs. They all work in slightly different ways. Some help your body get rid of extra salt and water, others help relax your blood vessels, but the bottom line is they've all been shown to be really effective at lowering blood pressure and, more importantly, reducing your risk. So who actually needs them? This table makes it super clear. If your pressure is 140/90 or higher, the answer is yes, period. If it's 130/80 or higher and you have other risk factors like heart disease or diabetes, the answer is also a clear yes. Now, if you're in that 130/80 range but your overall risk is low, then you'll start with a solid trial of those lifestyle changes first.
And finally, let's get to what makes these 2025 guidelines so cool. There are some truly practice-changing new recommendations in here that really point to where treatment is headed. This is the new and next.
First up, get this. There is now an official recommendation for potassium-based salt substitutes. You know, the kind you can find right in the grocery store. For anyone who adds salt when they cook, this is such a simple, easy swap that is now officially endorsed as a way to help lower blood pressure.
Okay, this next one is wow. It's a huge deal. The connection between your blood pressure and your brain health is now stronger and more explicit than ever. The guidelines are recommending a target of less than 130, specifically to help prevent cognitive decline and dementia. This isn't just about your heart anymore. Controlling your blood pressure is about protecting your mind.
And there's a critical, and I mean time-sensitive update for managing severe high blood pressure during pregnancy. This recommendation calls for urgent treatment. We're talking within 30 to 60 minutes to prevent serious harm to both the mother and the baby. This is a massive step forward for maternal health.
So, there you have it. These are the new rules. They're clear, they're more actionable, and they put so much power right back into our own hands. You know, your blood pressure really does tell a story about your health. So the only question left is, what will your next chapter be?